So what's up guys, I hope you have a great day, you are doing well. So in this episode I would like to tell you about the etiology, the common cause factor of chronic renal failure. As I already told you in my previous videos what is renal failure, what are the treatment protocols of the renal failure, and now I will tell you about what are the causes factor and what are the reasons behind the renal failure. So let's begin. So first is diabetes mellitus. The person who is suffering from diabetes is very much chance of suffering from chronic renal failure. Then the glomerular nephritis, that is associated with the renal or nephrons disturbance. Then polycystic kidney and hypertension. The person who is associated with hypertension along with polycystic kidney is very much likely to chance having renal failure. So what is pathogenesis? Pathogenesis is basically the mechanism of chronic renal failure. So if the number of nephron is decreased in our body, then our kidney adapts some hyperfiltration mechanism by which the focal segmentation glomerulus, Singer, nephron GFR, and the renin angiotensin aldosterone system disturbed, which in the response, which in then collectively lead to kidney failure. As I already explained you in my previous lectures, in my previous videos, that if the person is associated with hypertension along with diabetes and the many symptoms associated, then collectively the person is very much likely to chance having the renal failure. And in the main hormonal system in our body, focal segmentation glomerulosclerosis and the renin angiotensin aldosterone system disturbed, which lead to renal failure. So pathophysiology is alteration in the fluids and electrolytes, metabolic acidosis, I told you, anemia, that is blood loss, renal osteodystrophy, complication of the uremia. So what is the alteration in fluids and electrolytes? If the person has loss of less amount of GFR, it means the sodium and water retain. If the water and sodium retain our body, then the person is very much likely to chance having the edema or puffiness in the body that is led to swelling. Or if the fluid accumulate in a body, then there is a shortness of breath and the pulmonary edema, loss of airspace. So both these collectively lead to edema or pulmonary crackles. If there is alteration in the fluid electrolyte, it means, as I already told you, that kidney has a function to maintain or filter the blood, and if 3 sodiums comes inside, then 2 potassiums comes outside. If 3 sodium come inside and the inside sodium can be removed but potassium can't be removed, then that potassium lead to hyperkalemia. So that is hyperkalemia, inability to secrete potassium in the urine, that lead to malaise, palpitation, arrhythmias. So metabolic acidosis, basically H positive secretion from the body is impaired, that lead to metabolic acidosis, and the metabolic process leads to production of some acidic free radicals that cause acidity. So that basically leads loss of lean body mass and weight loss, alkalosis. In anemia, loss of erythropoietin release, then it means the red blood cells production has been decreased, or the red blood cells having the hemoglobin that has the ability to carry the oxygen is unable or impaired, that leads to anemia. That collectively fatigue, reduce exercise capacity, and pallor. So what is renal osteodystrophy? Renal osteodystrophy is basically when the kidney fails to excrete phosphate, and the kidney fail to excrete phosphate, and high parathyroid hormone levels can lead to hyperphosphatemia. Basically the term is called hyperphosphatemia, but in this slide I already told you that if there is kidney has high parathyroid hormone levels and fail to excrete phosphate, lead to hyperphosphatemia. Yeah, in renal osteodystrophy, early stages hyperphosphatemia and the later on increase 1-alpha hydroxylase enzyme by negative feedback can lead to hypocalcemia. In renal osteodystrophy, to compensate the low calcium, our body produce more calcium, osteoclast cell, parathyroid hormone. Parathyroid hormone basically secrete a lot of calcium to compensate the low calcium level in our body. And secondary tertiary hyperparathyroidism occur, that is high bone turnover. In renal osteodystrophy, high bone turnover lead to high blood calcium levels, that is osteoporosis, osteomalacia, calcium deposition in soft tissues. So complication of uremia is urea and other toxins accumulate in the blood and cause life-threatening issues. Uremia-induced platelet dysfunctions, uremic pericarditis, and uremic encephalopathy. So complication of uremia is uremia-induced platelet dysfunction, that is increased tendency to bleed and ecchymosis. Uremic pericarditis, chest pain, malaise, uremic encephalopathy, headache, confusion, coma, that all leads to pericardial friction, rib, ecchymosis, GI bleeding. And in the last slide, that is chronic kidney clinical manifestation, that if the kidney function is not performing well, sodium does not balance, potassium does not excrete, acid does not excrete, calcium or phosphate does not balance, erythropoiesis does not occur, then all the chronic kidney disease can happens. If sodium is not balanced, sodium retain and volume overload that lead to arrhythmias. If potassium can't excrete in our body, that leads to hyperkalemia. If acid can't excrete in our body, then metabolic acidosis happens. If calcium and phosphate balance does not occur, then this term is called phosphatemia. And erythropoiesis, then anemia. So this is